Hello people, in this video we want to unscramble some scrambled words from surgery. Try this one. The first one here, something to do with your nails and it starts with a P. Did you guess it? It's paronychia. Are you able to see? Paronychia, guys, is the infection of the skin around your fingernails. Okay, let's go to the second one now. Try this one, guys. It's a condition. I think it begins with a H. What do you say? Yes, let's look at the answer. It's hernia. Very good. Let's go to the third one. What do you see here? Do you want a clue? It starts with an S, something to do with the salivary glands. And it is like sialadenitis. Okay, so what does sialadenitis mean, guys? Sialadenitis is inflammation of the salivary gland. Okay, itis is actually inflammation, so sialadenitis is the inflammation of the salivary gland. Let's go to the fourth one. What do you think this is? It begins with an F. It's a condition, benign condition of the breast, usually affecting younger women. Fibroadenoma. Very good. Let's go to the fifth one now. What do you see here? It starts with a C. It's something to do with the testes, etc. What do you think the condition is, guys? It is cryptorchidism. Very good. Basically, it is the testes fail to descend. Okay, so that is cryptorchidism. It usually descends by birth, during birth, just after birth, etc. So that is cryptorchidism. Let's go to the sixth one. All these are surgery topics, guys, so think surgery. What do you think this one is? Some stone kind of a thing. Calcium. Starts with a C. Calculi. Very good. Like renal calculi. You have stones in the gallbladder, right? Cholithiasis. Very good. Now let's go to the seventh one here. What do you think this one is? Do you want a clue? It starts with a C. Something to do with the gallbladder. Cholithiasis. Lithi again is stone, isn't it? Cholithiasis. Let's go to the eighth one. What do you think this one is, guys? Something to do with the testis. Begins with a H. It's a hydrocele. How do you define hydrocele, guys? Hydrocele is basically swelling in the scrotum that occurs when fluid collects in the thin sheet around the testicle. So there is fluid around the testicle. Now let's go to the ninth one. What do you think this one is? You want a clue? It's actually the name of a car beginning with M. It's actually the Mercedes. Where do you see this Mercedes sign? Do you know this? There's a sign called Mercedes sign. And where do you see it? Something like this, isn't it? The Mercedes sign is something like this. So you actually see this kind of a sign in the gallbladder. Okay. So basically it describes something about the gallstones. Okay. Cholithiasis. So Mercedes-Benz, where is it in your body? Gallstones. Okay. You have a Mercedes-Benz. Okay. Actually Mercedes, right? There's no Benz word I'm thinking. Is there a Benz word? Yes, it is a Mercedes-Benz sign. Okay. Let's move on to the next one. What do you think this one is? Do you want a clue? It begins with a H. Basically, the varicose veins that you call in the rectum, anus, the person will be bleeding when he passes stools. These could be painless, painful later. What are those? Hemorrhoid. What is hemorrhoid? Actually, what is hemorrhoid, guys? How do you define hemorrhoid? So basically, hemorrhoid is a swollen vein or group of veins in the region of the anus. Let's go to the 11th one. Oh, we are done with 10. That's great. So we should have a celebration. Celebrate. 10 over. Let's go to the 11th one. What is this? Scar. How does the scar look later? It is hypertrophy, then it becomes a... Yes, it starts with a K, guys. Come on, think. Keloid. So it is crossing the boundaries. That time it's a keloid, right? Now let's go to the 12th one. What do you think this one is? Take your time. So basically it starts with M. So what is it? The answer is Meckel. Where do you see Meckel in surgery? Have you heard of the Meckel's diverticulum? Then have you heard that they'll do a surgery called Meckel's diverticulectomy? Okay. So let's go to the 13th one. What do you think this one is? This is a nice one actually. I think it starts with a V. And this is something that our country, our world needs a lot. Because the burden should not be on the woman. If giving birth is the responsibility of a woman, not giving birth should be the responsibility of a man. So it is vasectomy. Very good. It's a very, very simple outpatient procedure, minimally risk and minimal invasive. We should enforce our own men to get it done. What is this, guys? This is an instrument, if I'm not wrong. This is starting with a V, guys. So, starting with a V. So it's a needle. It's called as a V-rest needle. Why do you think a V-rest needle is used? So basically this is used in laparoscopy, guys. V-rest needle. Okay. So this could be an important terminology in surgery for you. Let's go to the 15th one. What do you think this one is? Take a clue. It is starting with a P, and it is actually a strange word, pyrone. Where do you hear this word pyrone in surgery? Basically, it is a disease, it's a non-cancerous condition that develops on the penis. Okay? Pyrone. If you didn't get this one, ignore, guys, because this is really complicated. Okay, let's go to this one. What do you think this one is? It starts with F. So they'll talk about chest, sometimes. Flail chest. Basically, they are telling you that if there is an injury, there will be, to the chest there's injury, there will be rib fractures, and the chest, right, it will be out of sync with the chest wall. So that is flail chest. Let's go to the 17th one, guys. What do you think this one is? Take a clue. It starts with a P. You've heard of a lot of things with this word. Something of the breast, bones, etc. Page it. Page it. Very good. Page it. Let's go to the 18th one here. What do you think this one is? And what do you think it begins with? It begins with D. Difficulty in swallowing. What do you call that? It's dysphagia. Very good. Coming to the 19th one, guys. What do you think this one is? It starts with H. Something to do with the urine, blood in the urine. It's called hematuria. Let's go to the 20th one. What is this? The word is actually beginning with E. Exo, some kind of a hernia, you can say. Exomphalose. What is exomphalose? How do you define exomphalose? Basically, the organs of the abdomen are sticking out through an opening in the around the umbilical cord. That is exomphalose. Okay, you will see it usually in children, like at newborn. Let's go to the next one, guys. Oh, we are done with 20. Great. Nice. Are you ready for more? Shall we go to the 21st one, guys? What do you think this one is? Take a clue if you need to. It is starting with a P. You would have heard about it in breast. It is phyloid tumor. Very good. So what is typical about a phyloid tumor? Basically, there is leaf-like pattern, guys. So it is a rare breast tumor. Let's go to the next word here. Guess this word. What do you think this one is? Take your time. If you want a clue, it begins with W. This may be a little technical for you. Something to do with the tumor again. Wharton tumor. Where do you see Wharton tumor, guys? I'm thinking in the salivary gland. What do you say? Yes, of the salivary gland. It's again a benign tumor. Let's go to the 23rd one. What do you think this one is? Surgery is very vast, of course. So you will have to know a lot of words. All these terminologies definitely you should know as an MBBS student. So what do you think this one is, guys? It starts with a T. Something to do with the thyroid gland descending embryonic structure. Yes, a thyroglossal cyst. So thyroglossal is the word. Okay. Very good. Let's go to the 24th one here. What do you know? Do you know something about this term? Very easy, guys. It starts with an A. Something to do with a organ that is attached. Can we say organ? Something that is attached to your cecum, which can get inflamed and becomes an itis. Appendicitis. Very good. 25th one. Come on. What is this? It begins with D. So it's a tumor. It sounds actually very similar to dermoid. I showed you the answer. It sounds very similar to dermoid, but actually it is desmoid. Okay. It's actually desmoid tumor. This is something that can occur anywhere in the body. Okay. They grow from connective tissue. Fine. Fibroblast cells, etc. Try this one. Do you want a clue? This is another very difficult one. It starts with A. Antibioma. What do you mean by antibioma? It's a tough-walled abscess. Okay. What is an antibioma? A tough-walled abscess. Okay. Very good. Let's go to the next one. 27th one here for you. What do you think this one is? Do you want a clue? The clue is, it starts with a P. In this case, they do circumcision. If this condition is there, only that time you can say that circumcision is required medically. What is it? There's an inability to retract this foreskin. So they'll remove the foreskin. Yeah. Phimosis. Phimosis, inability to retract the foreskin. Okay. 28th one. Guys, what is this? Yeah, very good. I think you guessed it. It starts with an M. Something to do with pigmentation. It's a carcinoma. Cancer, melanoma. Very good. Though it is having only oma, but still it is a cancerous condition, isn't it? The thing is, if there is any cancer if it is malignancy, you should use the word sarcoma or carcinoma. If it is usually only oma, it will be benign, but this is not the condition in this. This is actually malignant. Okay. Let's go to the 29th one. What is this? It starts with a V. So what do you mean by this word? It's called volvulus, basically abnormal twisting of the part of the large or small intestine. If it's twisting, okay, then you can call it as volvulus, like for sigmoid, volvulus, sigmoid colon. Okay, 30th one, guys. What do you think this one is? We just have 50, guys, only 50, 53 we have. So look at this. What do you think this one is? I'll give you a clue. It is starting with P. Something to do with a syndrome, iron deficiency, esophagus, something the person cannot swallow. What is this? Plummer-Vinson syndrome. Plummer-Vinson, is it? Vinson. Plummer-Vinson. Okay, VIN. Plummer-Vinson syndrome. Okay. Iron deficiency anemia leading to difficulty in swallowing. That's dysphagia. Oh, we finished 30. Yippee! Now it's time to take the 31st one. Come on, try this one. Do you want a clue? It starts with a C. It's something like, in Sherlock Holmes you would have heard this, the blue. But in surgery it is there. What do you mean by this word? Carbuncle. Yes. It's a cluster of boils, painful, pus-filled lumps. Okay, carbuncle. 32nd one, guys. This is very small. It's something to do with the inflammatory bowel disease. Yes, it starts with a C. You guessed it right. Crohn's disease, where there are strip lesions. Okay. 33rd one. What do you think this one is? It starts with NEM. And it's an ulcer yes, name of an ulcer. Marjolin ulcer. What do you mean by Marjolin ulcer, guys? It happens after burns, isn't it? When does it happen? From burns. Very good. 34th one. Oh, that's a long one. Hope it's easy. Something like the parliament or something it is. What do you think this one is? I need a clue. Something to do, start with the T. You hold a torch, and for a cyst or something you will find. For the swelling you will say whether the swelling is this or not. What do you say? It is transilluminant. Very good. 35th one. We're almost nearing our goal. Come on, say what is this? It starts with a V. Very common in security, policemen who stand a lot in their legs. What will you find? Varicose veins. Very good. Varicose veins. Varicose. 36th one. Try this one. Do you have any idea? This is a very difficult one, I think. It starts with an R. It sounds like a name of a person. It is Ranson. Where do you hear Ranson in surgery? In acute pancreatitis, some scoring is Ranson score, guys. I think this one is a little difficult. Let's move on. 37. Something like Cardi is there here, but I'm not sure what it begins with. Let's see. It starts with a C. Go for it. And it's kind of a tumor. It is cylindruma. Where will you see this cylindruma? You can see it on the scalp, etc. Okay. Let's go to the 38th one. What do you think this one is? Starts with an M. Some disease, dash disease, starting with an M. And let's tell you a little more clinical about this. So basically it is a disease which is characterized by thrombophlebitis of the superficial veins of the breast and anterior chest wall. Yes, you guessed it right. Maunders disease. Okay, you should know this as MBBS students. You should know this much. Maunder disease. Okay, thrombophlebitis. 39th one. What do you think this one is? Starts with a C. A very difficult word sounds like. And what does it mean at all? Basically, this is something to do, corvois here is some gallbladder score or something, okay? Okay, this is a sign which refers to the gallbladder that has become swollen due to the buildup of bile. Okay, that is a corvois sign for the gallbladder, guys. That's really complicated. If you know it, great. Otherwise, let's move on to the 40th one here. What do you think this one is? This is starting with a D. And let me give you yet another medical clue. So it's a cyst. It's a common type of odontogenic cyst. What is an odontogenic cyst? Something like a jaw, tooth, etc. This is a dentigerous. Okay, dentigerous cyst, etc. are there where teeth. Okay. 40 done, guys. Just another 10 to go. Let's see if you can do it. Try this one. What is this? This is also very complicated. It starts with a T and it's like a 3 something. And where do you actually see this? The word is tricho. Mass of undigested hair within the gastrointestinal tract. What the hell? Tricho is always referring to the hair, isn't it? But it's in the wrong place, I feel. Anyways, what is this? It is starting with a P. It's about not being able to move properly. What do you say? You cannot move it. It is paralytic. Very good. Paralytic polio. Very rare, but can happen, isn't it? 43rd one. What do you think this one is? Take a clue. It is starting with H. and it's a disease, dash disease, and it's more like spring, you know, starting with a H, and Hirschsprung disease. It's a birth defect, okay. Some nerve cells are missing in the large intestine, so it cannot move the stools, right? It becomes blocked, constipation. Hirschsprung disease. Let's go to the 44th one, guys. We're almost at the end. Don't worry. What do you think? I feel like it is some scopy. What do you think this one is, guys? The starting letter is, oh, it's difficult. Actually, it is difficult. It is not what I said. It's starting with a P and it's like false, pseudocyst, okay. So where will you see pseudocyst? Have you heard of pseudocyst? Pseudocyst of the pancreas. Very good. Pseudocyst of pancreas you have heard. Next, 45th one. What do you think this one is, guys? We'll give you a clue. It starts with F. Basically, it's a condition of the scrotum. It's dash gangrene, starting with F. Acute necrotic infection of the scrotum. The answer is fournier, okay? May be very complicated for you. Let's go to the next one. What do you think this one is? Do you want a clue? Starts with an F. How do you define this? It is basically abnormal connection between two body parts which are lined by epithelium, right? And there'll be some granulation tissue inside it. So that is the definition, isn't it? Starting with what? F. So it is a fistula. Very good. Like you can have a vesico-vaginal fistula, cutaneous fistula, is it? Etc. Look at the 47th one, guys. Did you guess it? It's again a condition starting with C, slightly complicated maybe. It's actually something to do with gallbladder, and it is, what did I say? It's a triad, okay? So the triad is jaundice, fever, and right upper quadrant abdominal pain. Right upper quadrant abdominal pain. Yes, it's Charcot's cholangitis triad. Okay, Charcot cholangitis. Let's go to the 48th one, guys. What is this? Let's see if this is at least easier. Yeah, it is easy. It starts with G, some swelling of the neck, thyroid. What do you call it? As goiter. Okay. Now, this goiter can be associated with hypo or hyperthyroidism. Okay, but goiter is just the swelling. What is this? Yes, you have heard so many times this word. Pute. Putes. Where do you see this? Putes, Jagger's syndrome, etc. So this is basically growth of hematomatous polyps in the gastrointestinal tract. These are non-cancerous, okay? Putes, Jagger's syndrome. Let's go to the last four are there, guys. Just hang on. Oh, we are done. This is the 50th one. So yeah, focus here. 50th one. Do you want a clue? This is easy only. Some twisting is happening. Dash of the ovary. It can happen of the testis also. How do you define this? Yeah, it's torsion, guys. Torsion of testis, torsion, twisting. Okay. Then it can go into necrosis and all that. Now coming to the... Guys, we're done with 50. That's amazing. Just 3 more left. Let's focus. What do you think this one is? Take a guess. This is slightly difficult. It starts with an E. And we have absolutely no idea what it means, right? And it is... what did we say? It starts with an E. Basically, it's a tumor-like enlargement, okay, in the mucosa, gingival or alveolar mucosa. So it is epulis, okay, epulis. It's an enlargement situated on the gingival or alveolar mucosa, something in your mouth, okay. Epulis. Now let's go to 52nd one. Do you think this one is? I feel it's more like a stomy, some procedure. Right? Something to, starting with C. Yes, it is colostomy. Okay. Now last one. Wow. Last one, guys. Last one. Come on, let's do it. What is this? Starts with an E. And we have absolutely no idea what it means, right? Now coming to the... Guys, we're done with 50. That's amazing. Just 3 more left. Let's focus. What do you think this one is? Take a guess. I think I can kind of look at it. I feel I know what it is. It's hydro, and the kidney. Because of urine backflow. What happens to the kidney because of urine backflow? Hydronephrosis. Very good. That's it, guys. We have looked at so many surgery words. I hope you have learned a few at least. Watch this video again and learn few more words whenever you get time. Okay, bye bye.